Welcome to Books for Success. Today, we're delving into the wisdom within Healing Back Pain by John E. Sarno. Healing Back Pain is a very insightful and helpful read from the mind of the experienced and qualified author and psychotherapist, John E. Sarno. It boasts of answers to hard questions and clears up the misconception that pain is only physical. It is an expose into the mind and how much influence it holds on the body and the associated responses. Has your back been acting up again lately? Your last doctor's appointment was just a week ago, yet you are in pain again. Maybe it's the chair, but you replaced the chair yesterday, so it can't be the chair. No, it's not the chair. The problem is nothing physical, and it's something your mind can fix. Want to know more? This top-selling guide will teach you. 1. How stress is an enabler of TMS, tension myositis syndrome, and back pain. 2. Why conventional medicine has not been able to tackle the widespread problem of back pain in America. 3. The methods available to truly heal from the clutches of TMS and back pain. Subscribe and ring the bell for notifications if you want to keep receiving the knowledge of book summaries about health, wealth, love, psychology, and much more. Don't be shy about dropping your book suggestions for us to summarize. Also, you can use this video as an audiobook summary. Let's grow and succeed together. Back pain most of the time does not come from a spinal or muscle issue. Pain does not always originate from an accident. It is a common misconception that pain in the back area is also from some muscle incompetence or a weakness in the spinal area. But because of a condition in the muscles, ligaments and tendons brought on by tension, emotional strain. TMS is caused by specific, common emotional situations. Who can get TMS? It starts from a young age, around the age of 6, when TMS is often confused as growing pains, even up until the age of 80. There is no age limit or restriction. As long as you have emotions, you can get TMS. With a majority of sufferers between 30 and 60 years, which is tagged the responsibility years, suggesting that the back pain is brought on by the emotional strain that comes with the need to succeed with career and life. TMS manifests itself in the muscles of the back, neck, and buttocks, known as postural muscles, the most common area being the muscles of the butt. It also manifests in the nerves, peripheral nerves that are often located nearest to the muscles that are commonly affected. It presents with a shock-like pain as a result of oxygen deprivation in the muscles, nerves. It also affects tendons and ligaments, tendinalgia, with notable sites being the elbow, knee, ankle, and shoulder. Repressed negative emotions are a trigger for TMS. TMS commonly presents with acute symptoms even though manifestation can be slow or delayed. It can occur anytime, from vacations, weekends off or holidays. TMS can also be a product of conditioning, programmed responses to actions perceived to cause or bring on the pain. It can occur in frequent acute spells of muscle spasms that plague the sufferers. It is important to note that the pain isn't linked to any physical or structural incidents but rather the brain's association with the incidents. To truly grasp the full scope of TMS, one must understand the psychological implications of the condition. To really understand TMS, we must look at the psychological portion of the condition. Most physicians are unaware of the emotional part and, as such, offer terribly misguided advice and treatment for back pain. Even though TMS is characterized by physical pain, the acute persistent discomfort is more emotional than physical. One of such emotions is tension, which refers to repressed, unacceptable feelings, and these feelings contribute greatly to the occurrence of TMS. Another emotion that plays a part in the occurrence of TMS is stress. Not to be confused with tension. Stress is any number of factors that cause an individual considerable strain. This ranges from finance to just about anything that poses a psychological strain. Stress can be internal or external, with the latter comprising factors such as your job, illness, family, responsibilities, bills, and so on, while the former is much more complicated and involves complex emotions such as self-esteem, perfectionism, procrastination, and so forth. An important part of the psychological aspect of TMS is the conscious mind, the part of the mind we are fully aware of and in control of. These include our willful character traits and behaviors we knowingly allow. One trait of someone who has or might have TMS is a contentious behavior, making one prone to discord and the awareness of this behavior. Oftentimes the real culprit for all this is the unconscious or subconscious mind. Most of the traits we exhibit are a result of the deep, unsanctioned thoughts, feelings that are locked away. These feelings are undetectable by the conscious mind because they're trapped below where our conscious, aware mind can reach, but account for the character traits that drive our everyday life. For a person with TMS, a few standout traits are the need to overcompensate a shortcoming, low self-esteem, a strong drive for success and a fear of failure, anger and crippling anxiety, narcissistic outlook, and the need to repress feelings. It is important to note these because certain other illnesses present like TMS, such as pre-ulcer states peptic ulcer, hiatus hernia, asthma, spastic colon, tension headache, dizziness, and a host of others. These conditions might show signs of pain similar to TMS but won't come hand in hand with the psychological symptoms associated with TMS. It is good to note that the mind has a greater influence on the onset of TMS even though physicians prefer to blame it on physical incidents. The pain is usually associated with a deep-seated fear of an unrelated event. But as long as the mind associates the physical pain with the event, the occurrence will persist. As such, it is important to take a look at the physical side of TMS. We know what happens psychologically, but what really happens physiologically? Well, first, TMS starts in the brain where those nasty emotions are repressed. This is represented in a physical response via the autonomic nervous system. This is the part of the body responsible for involuntary responses, actions. Basically, it is responsible for how fast you breathe, how much blood the heart can pump, and how much oxygen goes where and when. So, when you are freaking out or frozen solid in fear or aching from TMS, you can thank your autonomic nervous system. Since TMS presents with physical symptoms, it is fair to assume that the autonomic nervous system is fully involved in the process. Its response to tension, stress or repressed emotion is reduced the oxygenated blood flow, which leads to pain in the muscle and nerve system, which is the whole case with TMS. We can see now that although TMS is all in your head and is a product in the whole of the unconscious mind, it manifests in quite real physical pain with help from the autonomic nervous system. The conventional diagnoses and treatments for TMS are often very unhelpful. To treat a condition as delicately complex as TMS, you must first be willing to think psychologically. This means that when pain manifests, instead of thinking of the physical pain, consider the possible emotional triggers. But knowing what emotional triggers cause the pain doesn't necessarily make the pain go away because the subconscious mind isn't quick to adjust. Unlike the conscious mind, it takes time, but studies have shown that normal cases resolve themselves in 2 to 6 weeks. But it is important to note that it delays, and it is normal. But if patients keep count of the time the pain is supposed to go away, it might take too long. There are ways to make the healing process easier, which include talking to your brain, resuming physical activity, discontinue all physical, structural treatments, and review all daily reminders. Some patients find the whole talking to your brain part funny. But in truth, it is actually a very helpful method of managing the condition. It involves reminding your brain that what you feel is not because of a physical incident or injury but a psychological response to an emotional strain. Addressing the emotional strain will lead to resolving the pain quicker than any physical therapy would. In addition, it is also important to resume physical activity. Patients might have associated a fear of further injury or pain with a physical activity, but the best approach is to engage in more physical activities. One key treatment for TMS is physiotherapy, but not so much that it is rushed. The patient must first identify the activities they associate with pain and start with those and slowly dissociate the pain from them. Whilst engaging in more physical activity as a form of therapy, it is important for patients to discontinue wholesome physiotherapy as it only targets the physical aspect of the problem and will not fix the problem in the long run. Taking on the challenge of attempting the activities that before now caused pain is more of a psychological approach than physiological, as it targets the conditioning and not the physical effort itself. If after trying all of this and there is no improvement, it is advised to try group meetings. In any event of slow recovery in TMS treatment, it is usually because the patient either refused or is unable to muster the courage to accept the diagnosis. To create or generate said courage, he or she would have to sit in with other sufferers who also struggle with their own diagnosis, but are getting better. In this environment, there is a higher tendency for the patient to source courage and start on the road to recovery. Since TMS originates solely from the mind, there is great application for psychotherapy in treating the condition. Of course, the chief treatment for TMS remains psychotherapy, since the premise is that the condition is brought on by the mind and not a physical incident. Patients are advised to seek psychotherapy and not assume the pain requires some medication or exercise they saw on TV. People with TMS usually have a strong history of bad emotions that they've kept bottled up. These emotions might be so nasty that they don't just ease up even with the best of therapists. The role of psychotherapy is to help the patient address and deal with these feelings and not run away or shun them. They must accept the events leading to the feelings are real and that it is in the past and can no longer hurt them. If they have lost a loved one and the pain haunts them, psychotherapy can help guide them away from the pain. Slowly, patiently but effectively. Research shows that only about 5% of patients will require psychotherapy, and this low number is responsible for why only a few seek psychotherapy when they feel stuck. There are a few structural conditions that have been diagnosed and/or mistaken for TMS. It is important to note that these are the conventional diagnoses for cases that actually might be TMS. A sharp pain in the lower back, spine can be diagnosed as a herniated disc even though by the age of 20, the part of the spine is no longer present to even be displaced. In rare cases, there is a condition that can actually cause real physical pain. That condition is spinal stenosis, but it only occurs in rare cases. It also is misdiagnosed when, in fact, it is TMS. There exists a plethora of structural conditions that cause pain in the muscles, nerves, tendons, and ligaments but are not caused by any physical problem in the body, but in fact, are just the mind ignoring TMS and seeing what it wants to see. In order to avoid costly and life-threatening procedures, the patient should first undergo a psychic evaluation to see if the pain is indeed physical and not emotional. Serious medical treatment should only be prescribed if the patient is cleared of any repressed emotions to avoid worsening the symptoms. There aren't any real treatments for TMS besides psychotherapy, but sometimes the patients are unable to accept that simple therapy can fix their apparent pain. In cases where these patients demand real treatment, you can offer them placebo medication. This includes certain pills or physical activities that offer no real medical backing, but it makes the patients feel better. This surprising effect is owed to the fact that with TMS, the problem is psychological and as such requires an approach that involves working the mind. Placebo medication does for the patient what a therapist wouldn't do because they believe this pain they feel is physical. And as such, a neck brace or workout session is why they're feeling better. Whatever works is great. Their mind accepts this as a solution. Therefore, it is. Understanding the interaction between the mind and the body and TMS is everything you need for healing. As addressed in the previous chapters, the mind has a greater role in the body's health than we give it credit for, and it is important to fully discuss the interaction between the mind and the body and how it concerns TMS. The mind interacts with the cardiovascular system in a life-threatening way. The dangers of complications in the cardiovascular system include stroke and even death. But this isn't because of some physical incident. In fact, the mind is responsible. But how? The mind is host to the unconscious and conscious thoughts that form our behaviors and expectations. With information about the autonomic nervous system, it is known that an imbalance in the brain's chemistry can lead to irregular responses in the body. So, imagine a situation where one loses a job or work became too testy. The mind can cause the heart to starve the brain of oxygen and lead to a stroke. Another system the mind interacts directly with is the immune system. The immune system is responsible for protecting the body from a host of foreign dangers and even internal dangers too. The system was previously thought to be autonomous, but new research shows that the mind can influence its actions. There are cases where patients are simply in a lot of pain or fall sick because their minds had associated an event or encounter with the reaction. Take, for example, ingesting dirty water, which can cause cholera, but not unless the exposure is constant. Once the mind is aware of the normal reaction to dirty water, it can recreate the response once one ingests it even though the dose isn't enough to cause the illness. But it's not all bad. The mind can also cause the immune system to boost itself and tackle an illness. This has been shown to cause recovery even without medication. The mind interacts with the immune system in more ways, such as allergies and an overactive immune system. There are cases where one can exhibit allergic reactions to a certain medication, but not because of any real medical reason, but the physical reactions are very real. The case of an overactive immune system is noteworthy because it can lead to autoimmune diseases that are characterized by the immune system attacking the body. These kinds of diseases include lupus and rheumatoid arthritis. The mind and body connection exists in a lot of other systems and parts of the body. For one, the mind can be responsible for the unwanted breakout of acne or warts, and even a weak bowel unable to hold in spicy food or milk. The role of the mind in the body's reaction is greatly undermined, but it will be very beneficial if it is taken into consideration more instead. Conclusion. In today's world, there is always a case of pain either in the joints or back, and the culprit is usually some strenuous activity or an incident. But the truth is that these symptoms masquerading themselves as structural or physical conditions are actually a result of tension myositis syndrome, TMS. This is a manifestation of the mind repressing all the negative emotions we are uncomfortable confronting. Before you swear off all physical activity you tagged as pain triggers, you should seek the advice of a psychotherapist to identify the emotional background of your pain. If in fact your pain is legitimately a structural problem, then you should engage in physiotherapy. Thanks for being part of our insightful voyage. If our summary piqued your interest, we encourage you to dive into the complete book for a deeper understanding. Don't forget to like this video, subscribe for more content if you're new here, and share it with others who might find it valuable. Keep on reading, discovering, and advancing until our next adventure.